I think that the challenge is it's a major problem that we face in Africa. And I would want to say that one of the major challenges I want to speak to is the political will. Because I believe that the political will is actually what takes leadership, right? It leads and it drives policies within a country. If there's political will, then we know that there will be policies, there will be budgetary allocation to implement these policies, right? It will take the shape, it will take the form of other components, right, of cancer control would be able to there will be interventions in that area, even with research. So political will is very important, right, with in terms of cancer control within a country. And in terms of strategy to mitigate it, I want to talk about the steps that has been taken so far. In a country like Nigeria, that's my country, a country in West Africa, right? One of the major things they did was, in order to mitigate the cancer problem, was the establishment of the National Cancer Control Program. It was established in 2006, and it had 5 major areas: public education on cancer, cancer prevention, early diagnosis and treatment, effective therapy, palliative care. And in starting this program, they had stakeholders, right, from the private sector, the National Cancer Society, the Clinton Access Initiative. These are international organizations. They had, they included stakeholders from like Electa, right, a hospice association, non-governmental organizations. So the key stakeholders in cancer control were involved, and the updates of the national plan was made every 5 years. That was the first step that I think that was the major first significant step that was taken. And after establishment of this National Cancer Control program, it led to further sensitization of more stakeholders. For example, the Minister of Health back then was Professor Isaac Adewale. He's a gynae oncologist and former president of AORTIC, which is the African Organization for Research and Training in Cancer, right? So there was a spotlight on cancer, right? Several conferences were organized, establishment of comprehensive cancer centers, development of cancer programs, even by state governments. Then we had establishment of the National Cancer Society, Association for Radiation and Clinical Oncologists, African Coalition on Cancer. So these were major political advocacy groups that kept on pushing for more work to be done in the cancer space, right, in Nigeria. And so after establishment of that, this led to private, like I mentioned before, public-private partnerships, state government involvement. And the other thing, this then led years later, about 2 years ago, we now had the establishment of the National Institute for Cancer Research and Treatment, right? So what this institution now provides national leadership. The National Cancer Control Program was within the Ministry of Health. So now we have a standalone agency that just provides leadership on cancer research, prevention, treatment. It provides leadership on that, and it has actually developed the National Strategic Cancer Control Plan from 2023 to 2027. So you can see that there's that spotlight and there's budgetary allocation to keep running. Then the head of this organization is a radiation oncologist. So that is really good leadership going forward there. Then the other thing is that radiotherapy centers, right? All this has led to establishment of more radiotherapy centers. There was a paper that was published in 2010. What the outcomes of that paper, the paper outlined the number of radiotherapy centers functional in Nigeria at that time, 2010. we had only 5 linear accelerators and 3 cobalt 60 machines. Fast forward to 2023, all those machines have been decommissioned. And with all this advocacy and, awareness, we now have 25 machines in the country. All those other ones have been decommissioned. Now, this is not to talk about those ones in the pipeline. I can count about 12 other centers that are still in the pipeline that haven't started running. And now we have the first PET scan machine in West Africa. So if you see where we're coming from, right, it is from the advocacy, the need, the will of the government to actually do something about cancer. It then, moved in, it rippled into all these other components of it. And then also we have other components of, things like the Cancer Access Partnership, right, which provides anti-cancer medications across federal tertiary hospitals. Then we also have the initiative to upgrade the oncology centers, right, with Brachy. And so it's ongoing, as well as very important is the implementation of the Cancer Health Fund, right? I talked about affordability, that most patients have to pay out of pocket. So there is the implementation of the Cancer Health Fund, which provides financial support to residents, right, for coverage with regards to their treatment. And also private insurance companies now have coverage for cancer treatment. Then the state insurance scheme, it's now being scaled up. States are getting, aware, and they're scaling up their insurance schemes to include cancer treatment. So I believe that, if we adopt this stepwise approach, from this example of Nigeria across LMICs, we'll be on the path. It doesn't happen in one day. It's a journey. I mentioned 2010, and now this is 14 years later. So if we begin to implement this stepwise approach across African countries, we definitely will be on the path to reducing this impending surge in cases in the years to come.